Good afternoon, dear students. Let me discuss first part of globalization and health. So, let me define globalization. What is globalization? Globalization is a system of interaction and integration between individuals, businesses, and governments of different nations, where it is a process stimulated by international trade and investment that is based on information technology. Globalization has impacted our environment, our traditions, our political structures, our culture, our economy, our society, as well as our standard of living. Particularly, developing countries are facing a major public health challenges. This is because there is a complex relationship between globalization and health. Despite in recent decades, funding for global health has increased significantly, but globalization has increasingly challenged public health policies and practices, particularly in developing nations. Most importantly, several diseases have become extremely important for global concern. For example, HIV, AIDS, cholera, malaria, and predominantly ongoing COVID-19 pandemic. So let me discuss the growing impact of globalization for health and public health practices. As we can note here that globalization has main two characteristics, such as increasing global trade and the movement of people around the world that could affect health. Today, more goods circulated in more regions of the world and meet more goods and people than ever in the history. So globalization has amplified the circulation of goods and services. Due to globalization, borders are faded away, which creates new issues and challenges for global health, which increases the possibilities of spreading diseases very rapidly across the world. Indeed, not only goods and services cross the ocean and the country's border, but also diseases such as AIDS, malaria, tuberculosis, coronavirus, and so on. For example, the outbreak of bovine spongiform encephalopathy, which is commonly known as mad cow disease, in several European countries is only one example of how trade can promote the spread of dangerous diseases. Another example is mosquitoes that carry malaria have been found aboard planes thousands of miles from their primary habitats, and infected seafood carrying cholera bacteria have been shipped from Latin America to the United States and Europe. Despite blaming globalization, globalization has some positive impacts as well. First, it can improve access to the medicine, it can improve access to medical information, it can improve access to training that can help treat or cure these diseases. Secondly, drug and government industries are now able to supply drugs to remote areas of the world affected by the infectious disease. Thirdly, institutions and professionals who wants to place medicine or other treatments in the hands of those in need using their product distribution channels, communications technology, and transport technology have fostered globalization in the last decade. So let's talk about pandemic. What is pandemic? Well, first of all, let me define what is pandemic. Pandemic is a large-scale outbreak of an infectious disease. It crosses international borders and can cause disease and death in a large number of people. Now pandemics are usually caused by what we call zoonotic pathogens. So what is zoonotic pathogens? Zoonotic pathogens are organisms that jumps from an animal host to infect humans and then are transmitted among humans. Let's take a look at a couple of these reasons. There has been a dramatic change in the way we use land. Secondly, there has been deforestation and increased animal-human proximity in certain circumstances, which have increased in likelihood of one of these zoonotic pathogens jumping from animals to humans. Then of course, we have seen massive urbanization and increased population density. This has increased chance of an outbreak spreading and it makes more difficult to control. And of course, globalization has increased the possibility of a disease going global. So before we talk about what we need to put in place to protect ourselves from pandemics, let's look back at the important pandemics and epidemics that have happened in history. There was the bubonic plague or Black Death in the 14th century, and that killed up to 50% of the European population. Then smallpox in the 16th century killed more than 50% of local communities in Americans. Then cholera in 19th century killed more than 1.5 million people. And in the last century we saw a Spanish flu killing more than 100 million people. Then Asian flu in 1957 killed an estimated 1.5 million people. Then Hong Kong flu in 1968 killed 1 million people. Then HIV has killed more than 35 million people. In the last 20 years, we have seen SARS in 2003, swine flu in 2009, MERS virus in 2012, Ebola virus in 2013, Zika virus in 2015, and most importantly, ongoing COVID-19 pandemic. So, thank you very much. We end our discussion here. Thank you very much.